One question that we were wondering, we hear a lot of different statistics, and I wonder what you consider to be the most important to look at. Is it total cases? Is it hospitalizations? Is it the deaths? The positive test rates? Which of those do you look at, and which trends are most important when?
So I look at all of them all the time, and you learn different things from each one of them. So walking through them all, I think one of our most important and probably one of our least discussed is the positivity rate of tests. So we know that we've not had a rapid enough uptake of testing in the United States, and it's also been different in different states as far as when the testing was reaching a level that we might be comfortable with. And I think in most states, it's still probably not at the level we would like. But what we want are increasing test numbers with decreasing positive tests. So you want that positivity rate to be going down, and you really want it below 4 or 5%. So in the state of Georgia, it's averaging currently 14%. Across the state, but it's widely variable. So in Northeast Georgia and Hall County, we've had rates as high as 30%. So you have to realize you're averaging a whole bunch of different hotspots with that. So I think positivity of test rates are important. Of course, case counts we want to continue looking at, but that is going to be dependent on how we're testing. And so if we're not testing at a high enough threshold, those numbers are going to be an underrepresentation for sure of what's going on. And then as far as hospitalizations, really we want to be watching our hospital bed count and our ICU bed count. And so we want to have those numbers of open beds and open ICU counts to be somewhere at least at 35% of our capacity. We want that much open and available to us. And currently in Georgia, we've got 14% of our critical care beds are available. We have one region of Georgia that doesn't have any critical care beds available to them at this time. So that means people are going to have to move to another part of the state or even out of the state to get an ICU bed. And so those are really important thresholds for us to be looking at. So they all kind of have their different place.
So speaking of national efforts or even broad efforts, testing is one of those areas. What are some of the barriers to testing specifically in Georgia and what you're seeing across the country, whether it's cultural issues or just availability? What are the biggest stumbling blocks as we try to get to a higher rate or higher level of testing?
So at first it was availability of tests. So that was our first stumbling block. We not only didn't have enough tests, we didn't have enough parts of the test. So we didn't have enough swabs. We didn't have enough face masks to protect the clinicians who were doing the testing. I've been part of a bunch of the research that's looking at new kinds of tests, so you don't have to do the more invasive nasopharyngeal swab. It meant we could take a different type of swab, and we didn't need the same level of personal protective gear for clinicians to do it. And we could actually move from clinicians to trained staff to do it, but they didn't have to have a clinical degree. And so those are some barriers that were happening at the beginning. And as a result, the tests were kept for presumed cases of COVID-19. And so they were symptomatic individuals. Really, to understand what COVID-19 looks like across any community, you need to be testing a random sample of everyone, not just those who are presenting with symptoms. So we're moving into that some places in the country. And we're doing a lot of work. Emory is doing the very first national prevalence study to try to look at random samples across the entire United States to try to get a really good idea of what our COVID burden is, because we know we're highly underestimating the number of people who've had it. Additional burdens that I've seen personally in Georgia, in the Latino population in Northeast Georgia, is access to insurance and Social Security numbers being required, and different forms of ID. And so it is hard when you're already concerned about your status and your ability to stay safe in your community, to then want to go to a place that's asking you for a bunch of information that you may or may not have available to you. That's a barrier, and that's a barrier for a population that's having a very high risk of COVID-19. So that's a barrier we need to remove. We need to be testing. If you live here and if you are here, we should be testing you. especially if you're in a high-risk population. Security can feel really dangerous at some of these events. So we've got two pandemics going on. We've got racism and we've got COVID-19. And if you have a testing event that has a ton of security around it, you may not feel comfortable going to it for either one or many other reasons. And so you need to remove those barriers as well. We also know that testing events may not be accessible if you don't have a car, because a lot of them are drive up. And so you need to have ones that you can walk to. They need to be on hours that are not work hours, and they typically are during work hours. They're typically not on the weekends. And so one of the things we've been doing in Georgia is we've been taking testing events to parking lots of locations where we know there's high risk and not a lot of testing being done. So we're taking the testing to them, and we're trying to remove all the other barriers of the things we ask for when you come. If you don't have to drive, you don't have to show us insurance cards, you don't have to show us social security numbers, and we aren't going to have a lot of security there as an additional barrier.